Do you have patients coming to you that say, I went to my doctor, they prescribed me antibiotic, and now I want to rebuild my gut because I think there is damage in it? Do you have patients that come like that?
Yeah, I mean, sometimes in that scenario, like if they, got put on more of a potent antibiotic and then they started to develop like, diarrhea and bloating after the fact, stuff like that maybe, which it can happen. And medications is one thing that can perpetuate leaky gut, like many of them can. It doesn't mean it's the wrong thing to prescribe, it just means that might be one of the side effects to it, right? And at that phase, right, then we would still want to evaluate, because it's not going to wipe out all the flora, right? We'd still want to evaluate a stool test to make sure, like, do you have enough good stuff and how much bad stuff do you have, because antibiotic might not affect a virus or a parasite or things like that, but it might affect the bad bacteria, right? That's the goal of an antibiotic for bacteria. Right, so those are the things that we're looking at, is it might not affect some of the other microorganisms, and we need to figure out, like, do you have more than one thing going on? Do you have not enough of the good stuff, too much of the bad stuff, too much inflammation? Do you have elastase enzymes, like pancreatic enzymes, that are too low? And pancreatic enzymes also combat inflammation. So if you have a lot of inflammation in a patient and they're just barely borderline, you can bet a lot of those pancreatic enzymes are used to combat the inflammation and not as many to help them digest their food.
That makes sense.